Why you keep waking up to pee at night and what your body may be trying to tell you. You wake up once, then twice, maybe even 3 times every night. You tell yourself it's because you are getting older. Maybe you drank too much water before bed, but what if your body is trying to tell you something far more important? Because waking up repeatedly to urinate at night isn't always normal. In some cases, it may be one of the earliest warning signs of hidden health problems affecting millions of people. And the longer those warning signs are ignored, the worse the underlying condition can become. Today, we are uncovering the real reasons you keep waking up to pee at night and which signs you should never ignore. Doctors call this condition nocturia. It means waking up during the night to urinate. Occasionally, getting up once isn't usually a concern, but if it's happening 2, 3, 4 times every night, it's worth paying attention. Not only can it disrupt your sleep, but it may also affect your heart, brain, memory, mood, and overall health. The surprising part, many people focus on the symptoms but completely miss the cause. Number 1 cause, you may be drinking too much water before bed. This seems obvious, but many people underestimate how much fluid they consume in the evening. Water, tea, coffee, soda, alcohol, even healthy drinks can contribute. Your kidneys continue filtering this fluid while you sleep. Eventually, your bladder fills up and sends a signal to your brain. The result, another trip to the bathroom. But here is what many people don't realize. Certain drinks are worse than others. Caffeine acts as a diuretic. Alcohol can increase urine production and interfere with the hormones that normally help your body conserve water overnight. If your nighttime urination improves after reducing evening fluids, you've likely found the culprit. But if it doesn't, the next reason may surprise you. Number 2 cause can be high blood sugar. One of the earliest signs of diabetes can be frequent urination. When blood sugar levels become too high, the kidneys work harder to remove excess glucose from the bloodstream. To do that, they pull more water into the urine. The result, more urine, more bathroom trips, and more disrupted sleep. Meanwhile, blood sugar continues causing damage throughout the body. Watch for these additional warning signs: constant thirst, unexplained fatigue, blurred vision, slow healing wounds, increased hunger. If these symptoms sound familiar, it's important to discuss them with a healthcare professional because catching diabetes early can make a huge difference. Number 3 cause, an enlarged prostate. For millions of men over 40, this is one of the biggest causes of nighttime urination. The prostate sits just below the bladder. As it enlarges with age, it can squeeze the urethra that makes it harder for urine to flow freely. The bladder never fully empties, so even after using the bathroom, you may feel like the need to go again shortly afterward. Many men describe it as a weak urine stream, difficulty starting, dribbling after urination, feeling like the bladder never completely empties. While an enlarged prostate is often non-cancerous, persistent symptoms should always be evaluated, especially if they suddenly worsen. Number 4 cause is sleep apnea. Most people associate sleep apnea with snoring, but few realizes it can also cause frequent nighttime urination. When breathing repeatedly stops during sleep, the body experiences stress. The heart responds by releasing hormones that increase urine production. This means the bathroom trips may actually be a symptom of poor breathing during sleep. Common warning signs include loud snoring, morning headache, daytime exhaustion, difficulty concentrating, wake up gasping for air. Treating sleep apnea often reduces nighttime urination dramatically, but that's not the only hidden condition linked to nocturia. Number 5 cause can be heart problem. This is one many people never expect. During the day, gravity causes fluid to accumulate in the leg and feet. When you lie down at night, that fluid returns to the bloodstream. The kidney then removes the excess fluid, which means more urine production while you are sleeping. Pay attention if you notice swollen ankles, shortness of breath, fatigue, reduced exercise tolerance. These symptoms deserve medical attention, especially if they appear together, because sometimes your nightly bathroom trips are only the visible part of a larger problem. Number 6 cause can be certain medications. Some medications increase urination as part of their intended side effects. Common examples include water pills, certain blood pressure medications, some heart medications. Even medications taken earlier in the day may affect night urination. Never stop prescribed medications on your own, but if symptoms become disruptive, discuss them with your healthcare provider. Sometimes a simple tiny adjustment can help. Number 7 cause can be an overactive bladder. This bladder is supposed to store urine until it's appropriate to release it. But sometimes this bladder muscle becomes overly sensitive. Even small amount of urine can trigger a strong urge. Many people describe feeling as though they must rush to the bathroom immediately. Others experience leakage before reaching the toilet. An overactive bladder becomes more common with age, but can occur at any stage of life. The good news, there are treatments available that may help reduce symptoms significantly. When you should be worried, here is the question everyone asks. When is nighttime urination actually dangerous? You should seek medical advice if you wake up multiple times every night. Symptoms suddenly become worse. You notice blood in your urine. You have pain during urination. You experience excessive thirst. You develop swelling in your legs. You feel unusually tired. This sign could indicate an underlying condition that requires attention. Remember, the goal isn't to scare you, it's to help you recognize when your body may be sending an important message. How to reduce nighttime urination. Start by limiting fluids 2 to 3 hours before bedtime. Reduce caffeine in the evening. Limit alcohol before sleep. Maintain healthy blood sugar levels. Stay physically active. Manage your weight, and most importantly, don't ignore persistent symptoms. Your body rarely sends warning without a reason. For many people, waking up once during night is completely normal. But when it becomes a nightly pattern, your body may be trying to tell you something. Maybe it's blood sugar, maybe it's your prostate, maybe it's your sleep, or maybe it's a health issues you've never considered. The important thing is this: don't ignore this signal, because the sooner you understand what is causing it, the sooner you can take action. If you found this video helpful, subscribe for more health insight that could help protect your health and people you love. And remember, sometimes the smallest symptoms tell the biggest stories.